please. Please have a seat, introduce yourself, and tell us what you're here for.
I am Melissa McKinney. I'm an RN, been an RN for 10 years. In my facility, I work kind of everywhere. I'm their go-to when they're short. I do ER, cath lab, ICU. So I'm here to talk about the reporting system.
All right.
Go ahead. Okay, so what I have seen, I noticed this after my husband came to the ER after the first shot, that he was actually, we thought he was having a stroke. He was discharged with an adverse reaction to the COVID vaccine. Those are my fellow coworkers, so I asked them if you have reported anything, are you planning to report? And they said no. So I went further on and said, should I be reporting this? And they said, you can do what you want, but we're not trying to tell you what to do. We don't think you should be reporting. So that goes on. He gets better. I start having problems as well. I start noticing in the cath lab there is multiple blood clots. I'm not talking about someone having an MI. I'm talking about you can't even reach their vessel because they're so clotted off. This is anywhere from 3 days to 3 or 4 weeks after the vaccine. This could be the first shot, this could be the second shot. I'm having multiple people from the booster shots come in 3 days later, massive heart attacks, VTAC, stroke, died. He is not right anymore. He is going to go into a nursing home. And when I asked my physicians in the unit, is this related to the vaccine? 3 days post-vaccination, they say, no, it's not related. I have another girl, she is my age. She is bruising all over her. Multiple problems, low electrolytes, low, bleeding out now. They sent her home, won't even consider that it's the vaccination. So what I'm trying to tell you is that not only is there's not there's reality in my hospital. No one knows what that is. My managers, my head of the hospital, all three, and I'm telling you, ER, cath lab, and ICU managers do not know any vaccine reactions, what we're supposed to be looking for. They told me that within 15 minutes, that is when you'll have a reaction. Can y'all take that in? Within 15 minutes. These are the people of the head of the hospital. These are people taking care of critical patients in the cath lab, in the ER, in the ICU. And they think once you go home after 15 minutes, you are good as gold. You're good. It's not from the vaccine. That's a problem. That's a problem because your children, your grandchildren are going to come into these hospitals. If they don't know that it is from the vaccine, how are we going to treat them properly? I also wanted to say that the vSafe app, I tried to report my actual adverse reactions on there, but it doesn't give you a comment section. So it asks you how you're feeling. It gives you some smiley faces. I don't know if y'all have had to use it, but within 2 months, my 2-month check-in, when I started to seriously have some problems, it would not give me any option to put my reactions.
We do appreciate, and please, if you, again, like I told the other ladies, if you know people that have had adverse reaction, that number should be called, and even if it's post, and certainly these are, it's never too late, except to not call would be criminal, but to call. Next, I don't ever see you again, so you have a question for her, all right? Or would you like Jill to talk and then you talk? Ask. Ready? Okay, you have a question for you, ma'am.
Thank you. So I am your rep, and the reason why I asked for this hearing and asked for this information is because nobody knows this 800 number. And it's crazy that medical professionals across this state do not have this phone number. It's an embarrassment for patient safety, for nursing protocol, any other protocol you have in the hospital. You have protocols for everything, and to not have this is just wrong. And so I'm hoping, and I know LDH has hightailed it out of the room, but they need to be talking to their hospitals and their medical providers about this. This is not fair to patient care. So thank you for bringing it to my attention. Again, another brave face showing up down here and doing the right thing for patient safety. It's high time we start trying to protect our patients for every reason, not just specific reasons. Thank you.
And I can promise you LDH is watching. they're another place.